right, welcome to another episode of Plastic Surgery Uncensored. I'm your host, Dr. Rady Rahban, and what we're going to do today is a deep dive on labiaplasties. That's right, I said it, labiaplasties. We've chatted about labiaplasties before, whether it was on Q&A or etc., but it's a really important topic. It's a topic that I don't know that there's a ton of information. Obviously, it's very sensitive. It's a sexual and sensual area. It's kind of hard to get a guest to come on and talk about it, and people need to know. And interestingly enough, it's one of the most satisfactory type procedures that we do. In other words, patients who get it are so happy and they feel like it really made them feel better. So I'm going to give you the A to Z of labiaplasty. So let's dive in. Let's start with just basic anatomy. It's interestingly enough, a lot of people don't even really understand the whole anatomy down there. So let's talk about it. So the labia minore and labia majore. So labia in Latin means lips, and it refers to the lips of the vaginal opening. So we have the labia majore, those are the outer lips, those are the full ones. And then we have the labia majore, which are labia majore are outside, labia minore are the inside lips, and they tend to be very thin and sort of wrinkly type skin. The labia majore are more for cushion and protection, while the labia minore are just to close the opening of the vaginal entry, the introitus, and to keep things moist and the pH and the bacteria homeostasis intact. In other words, you need them. Having said that, in many people, those labia minore, the inner labia, may be asymmetric, may be incredibly long, may be redundant, so to speak. And then once you open up the labia, inside you'll find the clitoris at the top, and then over the clitoris will be some excess skin called the clitoral hood, which protects the clitoris, which is a sensory organ that obviously needs to be protected and only sort of present, if you will, in unique instances during intimacy. So that's the anatomy. A labiaplasty, for the most part, is just the removal or the correction of the redundant inner lips. So it's a surgery of the labia minore. And the reason that people get it done are the following reasons. Number one, it's because they're unsightly. In other words, they're intimate and they feel insecure. They don't like the way they look. And for some people, they're like, I don't get it. What's the big issue? But there are instances where the labia minore, either by birth and or pregnancy, become incredibly long and enlarged and can be quite unsightly to certain patients. So one of them is cosmetic and visual. Another is that when the labia minore become excessive, they create excess humidity and moisture, and it's a hygiene-related issue. For some, it's a comfort issue because when the labia minore are long, during intimacy, they may get caught when you are on a bicycle or a horse. So therefore, it's a comfort-related issue. And in some instances, it's asymmetric and one is much bigger than the other. So there are many indications for which people would want or seek to undergo a labiaplasty. The goal is to create a sort of a smooth appearance. In other words, the outer and inner lips are all in one plane, and therefore it looks cleaner and smooth, and there isn't about a bunch of redundancy. Now, when you go online and you look up labiaplasties, there's a lot of random information on there, and this is the reason why. First of all, there's a lot of weird techniques in my opinion. I don't think this is a super complicated procedure to do, and I feel like a lot of surgeons are making it more complex than it needs to be. Additionally, it used to be a procedure that was done by plastic surgeons, but now OBGYNs, your OB, who has access to you, is doing them. I'm not going to comment as to whether or not that's right or wrong, but naturally they have a captive audience and they do these procedures. You'll have to look at their work on your own. The technique that I prefer and the technique that I use is a very simple one. It's called a linear excision. In other words, we just simply remove the excess labia that is redundant or above the opening of the introitus. There are other techniques that are very complicated and, in my opinion, frankly, unnecessary. So what's the recovery like? That's a really sensitive area. It must be super painful, right? Not really. The labia themselves don't really have a lot of sensation. It's just loose skin. It's almost like the skin above your eyelid. The vaginal vault and the clitoris have a lot of sensation, but we're not messing with those. This is just the outer skin. And to be honest with you, it's actually relatively easy and quick recovery. It's It's about maybe a week, 10 days of some spotting and some healing along the edge. And then really, to be honest with you, you're kind of back in activity mode around 4 to 6 weeks. So the recovery is actually pretty reasonable and not really that uncomfortable. The question then is, what are the risks? What are the risks with this procedure? And to be honest with you, the one concern for people is like, oh my God, I don't want a bunch of scars down there. I'm going to be intimate with a life partner. I don't want them seeing a bunch of scars. It turns out that the scar along the labia minora is essentially invisible because of the nature of that skin. It's usually dark. It's usually got a lot of rugae or wrinkles in it. And it isn't something that is very visible. And frankly, I've never had a patient ever have an issue with the actual scar itself. The issue that is the so-called risk is removing too much. Because the way you remove labia is a very unique type of tissue. It's like foreskin and like areolas in that it's very stretchy. And so what can happen, and what has happened before, is that a surgeon will put too much traction, pull too much when they remove, and then when they let go, the labia essentially disappears. And I have seen patients, and it's irreversible, where one labia or both labials were excessively removed. And the reason why that's a problem is because you need it, because that labia is what keeps the vaginal opening closed and keeps the moisture and all the ecosystem the way it needs to be. Other than that, I really do think it's a fairly straightforward procedure. Obviously, there's bleeding and infection and things like that, but again, those are minimal. The last thing is, are there other things that we can do in conjunction? So in the area of vaginal reconstruction down below, here are the other things that can be done. One is, for some people, as they get older, they lose volume in their labia majore on the outer side. And so you can do volume restoration, whether that's fat transfer or even filler in the outer labia to create some volume so it doesn't look atrophied or old. The clitoral hood, the excess skin that hangs over the clitoris, can sometimes be redundant and therefore making it difficult to climax because, it requires the exact right positioning, and you can carefully, and I mean carefully, remove some of that redundancy. There are procedures done inside the vaginal vault. Usually those are not done by plastic surgeons, but rather the OB. And those are called vaginoplasties, whereby which, due to birth or what have you, the vaginal canal gets stretched and therefore becomes a little lax. And they can go along the posterior wall and kind of tighten it, therefore making the opening tighter, allowing for better intimacy and intercourse and things of that nature. So those tend to be the additional, if you will, adjunctive procedures that can be done. There are things like G-spot injections and whatnot, and I'm not really going to get into those because I'm not actually really sure that any of that stuff really works, but it's outside the realm of my expertise. But I can tell you, every labiaplasty I've done, the patients have been ecstatic, and in many of them are sort of semi-embarrassed, and there isn't a lot of information on it. So if you hear this episode and this is something that's been bothering you, I hope this is informative and it gives you some clarity and some information regarding the subject matter. So at any rate, that was a quick one. This episode of Plastic Surgery Uncensored. As always, two things. One, go write us a nice review. We love that. And two, share our episodes and our podcast with the people you love, because again, you have no idea which girlfriend of yours is literally struggling or crippled by her labia. And that might sound silly, but it isn't. And you sharing this may be, the thing that she needed to get her life going. So at any rate, that's yet another episode of Plastic Surgery Uncensored. As always, I'm your host, Dr. Rady Rahban, signing off.